When and how to use a polar screw or a polar pin. Let us try to understand the biomechanics of this concept. In a simple distal 1/3 femur fracture, right, this is after attempting to reduce with forces on the proximal and distal fragment, taking an entry slightly laterally to avoid varus. And the moment I pass a reamer over this guide wire, which is 8 mm in diameter, I can see the malreduction at the fracture site. So how do I correct this malreduction? Is by reducing the room in the distal femur by placing a polar pin in this case, which is a Steinmann pin, so that the path of the reamer will itself correct the fracture, reduce the fracture. The moment I pass a 10 mm nail, the nail itself will reduce the fracture. So that is the concept of a polar screw. Places appropriately, reduce the room in the fragment which is roomy, so that the reamer itself will guide the fracture into reduction. The nail itself will guide the fracture into reduction. A straight nail, a straight reamer without a polar screw in appropriate situations will malreduce the fracture. So avoid such malreductions. The only job left for me is to thump the fracture, achieve compression at the fracture site, and weight bear as tolerated from the next day for the patient. Right? Small cuts and wonderful surgery, distal femur nailing for appropriate situations. You can use the polar screw to get a more satisfactory reduction so that you can confidently ask the patient to weight bear the next day and get them back moving. Good luck, take care, and God bless.